At South Texas Health System, the health of you and your family has always been our top priority. It inspires us to be among the nation's healthcare leaders. We're proud to be home to the Valley's first and only freestanding children's hospital, the state's first dedicated heart hospital, the first behavioral health facility with private inpatient treatment, and Hidalgo County's first Level 2 trauma center. And we continue to transform healthcare, investing in advanced technologies and innovations to help you heal faster. It's that commitment to your health that has allowed South Texas Health System to build a reputation for excellence across 11 facilities, earning recognition for patient safety, cardiac care, robotic surgery, women's health, stroke care, and more. With our integrated network of nationally recognized facilities, freestanding emergency departments, physician practices, and outpatient centers, we are where you are, providing compassionate care and comprehensive services for you and your family. Greetings and welcome to our latest Let's Talk Your Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. On behalf of STHS, thank you for joining us. Good health is fundamental to overall happiness and fulfillment, enabling you to live a more active and productive life. Taking care of your health through preventative measures like regular checkups, healthy eating, and exercise can help prevent future health problems. So to help you prioritize your health, South Texas Health System hosts these monthly Let's Talk Your Health webinars. By providing important education on common health issues affecting our community, hopefully we can prevent, manage, and delay serious health issues. Now, in this installment, we'll be talking about migraines, a common type of headache that affects an estimated 12 to 15% of the global population. That's more than 1 billion people. A migraine headache is usually a moderate or severe headache felt as a throbbing pain on one side of the head, with the World Health Organization placing migraines as one of the most disabling medical illnesses on the planet. Although there is no cure for migraines, there are resources to help patients effectively manage their migraine symptoms. The more information available on the impact of migraines, the more patients and providers will advocate for better, more effective treatment options. So to learn more about migraines and what we can do to combat them, we're joined by Dr. Rosalinda Flores, a neurology inpatient hospitalist with South Texas Health System. Dr. Flores, thank you so much for joining us.
Thank you.
Now, you are not only a neurologist, you're also a migraine sufferer.
Yes.
So when did your migraines first start?
Mine started in high school. Around 17, 18 is when I first started having them.
And how often were you getting them at that time?
Back then, I was getting them almost every day. I would have a lot of migraines.
And as you got older, they seemed to subside?
Yes, mine settled down. I get them maybe once every few months now, not very often.
Knock on wood that we don't get one today in the middle of this webinar.
Yes.
And now in the hospital setting, obviously it's a more severe situation, but you still see migraines in the hospital setting, is that right?
Yes, I do. Not as often, but it varies. For example, this week I've already seen 3 or 4 patients with migraines in the hospital, but it's not very common. Usually it's the more severe patients that show up.
And what does a migraine feel like?
So a migraine is usually a throbbing headache. Usually it's only on one side of the head, but it's a severe throbbing headache, most of the time associated with nausea, vomiting, and you can have sensitivity to light and noise. But there's lots of different symptoms we can see with patients with migraines. They can vary from patient to patient, but that's the basic kind of migraine headache.
And how would you end up in the hospital with a migraine?
Sometimes what happens is the migraine doesn't go away. You can get a migraine lasting for days that it may not be typical for you, or you can have other type of symptoms that make you worry. For example, the patients I've seen in the hospital usually start having numbness, tingling, sometimes even weakness, sort of like a stroke symptoms, and that worries them and they come into the hospital.
Now, education is obviously very important, and you've put together a great presentation for us to teach us a little bit more about migraines. All right, let's get started.
Okay. So migraines are a neurologic genetic condition. Okay, we don't always know the exact cause. There's a lot of pathways that are involved with migraines, but we do know it's genetic and it's neurologically based. We think it's based on central activation of the nervous system, that causes recurrent severe throbbing headaches. Like we said, usually they're one-sided with nausea, vomiting, and sensitivity to light and sound. They can be very debilitating though, and they can last for hours or days. Some patients may have symptoms for just a few hours, but there are a lot of patients that can have headaches lasting for up to 3 days or longer. They can be different for each patient. Now, migraines are more common in certain people. For example, in women, they're 3 times more likely to occur, which we believe is because of the hormone fluctuations you have. But they can happen in children, they can happen in older adults. Usually they peak in adolescence and young adulthood, but again, anybody can have a migraine. Some of the symptoms we see in migraines can progress, for example, from up before 48 hours before you get the severe headaches. We typically divide it into symptoms that occur before you develop the headache, and some patients can pick up on these symptoms and realize they're about to have a migraine. Some patients can get tired, they can get brain fog, they can have neck stiffness, difficulty moving, they can even start developing the light and sound sensitivity at that time. Each patient is different. You can have different symptoms that may be related to other headaches, but you can also see in migraines like conjunctival injection, which means your eyes get red, irritated, tearing, runny nose, and then you can develop the throbbing headache. And usually that can last from 4 hours to up to 3 days is the typical migraine. But again, you can have some patients that have such debilitating symptoms that can last for several days at a time. And during this time, you have the movement sensitivity. Patients will say they have difficulty moving because any little movement will trigger the headache to be more severe. They become sensitive to light, to noise, some to even smell. That was one of my triggers. Smells, strong perfumes, different odors would trigger my migraines and worsen my headaches. And even after the migraine is completed, you can have a post-stroke syndrome, and a lot of people will feel very fatigued, very drained, and can continue to have that brain fog. These symptoms further delay you returning to normal activity and cause even more problems returning to your normal function, your normal life. And so although a lot of people may say migraine is just a headache, it's not. There's a whole complex system that gets activated, multiple pathways leading to all of these difficult symptoms that prevent you from doing what you normally do. So, like I said, it's a genetic condition with a lot of environmental factors that affect the nerve signals and change the way we process pain signals and sensory signals from our normal. Okay, multiple chemicals, serotonin, CGRP, get triggered and released in multiple pathways throughout the brain that we don't fully understand the complexity and how this is maintained, but all of these pathways lead to the different syndromes, the different symptoms you can develop during a migraine and the days before and after. Every patient has different triggers that can cause a migraine. Hormonal changes, these are some of the more common ones. Certain medications, alcohol, red wine in particular is known. Caffeine, fluctuations in caffeine, as well as excessive caffeine can also do it. Stress, which we all have a lot of stress, so learning to manage that. Bright lights, strong smells. Poor sleep is definitely a trigger for migraines. Lack of sleep can push you into having a migraine. Meals, skipping meals, not having an adequate diet can trigger migraines for a lot of patients. And certain foods like aged cheese, processed foods, chocolate is sometimes considered a trigger for migraines. Now, we have a lot of different management strategies. We can go into a few here. There's a lot of new medications, a lot of medications from the beginning for treatment of migraines, okay? Usually we have 2 types of medical treatment. Acute treatment is to treat a migraine attack at that moment. It's meant to try to resolve the headache and resolve the symptoms that prevent you from living your life. We have multiple medications we can use at home and in the hospital. Most of the common ones at home are things like ibuprofen, naproxen. However, of course, those are limited in certain patients. You can have triptans, which are as some patients know, the sumatriptan is one of them. Rizatriptan, we have several of those as well. We have the newer medications that were created specifically for migraines, the CGRP inhibitors as well. Those are the first to be specifically created for migraines. Most of our other medications were developed for other diseases and were found to treat migraines. We also have preventative medications long-term for patients that have recurrent migraines more often. I will typically recommend a patient consider preventative medication something you take every day if you have more than 4 migraine days a month, especially if they're debilitating. And again, we have multiple medications at this time that can be administered in different ways. You can have oral medications, monthly injections, infusions every 3 months. Botox is also one of them that I'm sure is pretty well known. And there's different classes of medications that can help with migraines. Now, one of the other options we have, especially in regards to these triggers, is lifestyle modifications, okay? Avoiding your triggers. For example, patients who've had LASIX are more susceptible to migraines because it makes you more sensitive to light. So if you have the combination of migraines and LASIX, I wear sunglasses most of the time now because I got LASIX and now my migraines are triggered. Practicing good sleep hygiene. Exercise. Exercise is very helpful with migraines. You know, we release the endorphins, helps you relieve stress. Eating a healthy, balanced diet. Managing stress is a big one. Managing stress in a way you can. And another important part would be to maintain a headache diary, that you track your headache days, you track your symptoms. If you find new triggers, new things that happen to you during these episodes, and discuss this with your physician in order to find the appropriate treatment for yourself, is a very helpful tool for us. Now, this is just to illustrate how complex migraines are. We know they're a genetic neurological disorder. We know that there is multiple pathways that are activated during a migraine, and these lead to the different symptoms that you endorse. We don't understand fully how these interplay with the peripheral versus the central nervous system to maintain the headaches and continue the pain, but we know that all of these symptoms, we have MRI imaging showing that these light up during a migraine headache, and finding these pathways and the chemicals that result from these pathways, like the CGRP, helps lead to new treatment options, which are always interplay.
All right, and that is all fascinating information, especially because I know so many people who have migraines, and now I've added another person that I know to the list. But 1 in 4 households in the U.S. is affected by migraine, and you talked about it affects women more than men.
Yes, about 3 times more.
And that is because of the hormonal fluctuations they were talking about, the estrogen and all of that. And it's 1 in 5 women, 1 in 15 men, and they tend
even children though as well.
And they tend to usually begin in early adulthood, but as you mentioned, you can start experiencing them as a child. You were in high school when you started getting them. And do you remember, like, was there something specifically that did your family have a genetic history? So
both of my mom and my older sister do have migraines. So I kind of knew what the symptoms were, and I would always start feeling very tired, very exhausted before I would get a migraine. I never had the auras. There's a lot of patients that will get visual auras, you know, the bright lights. That's also a symptom of some migraines. But I would then start getting a severe throbbing headache, to the point, you know, in high school, my teachers were aware of it. I had an excuse to be able to put my head down in class if I needed to, or step out.
Now, when it comes to migraines, they're often misunderstood, misdiagnosed, or undiagnosed. Why do you think that is?
I think it's because a lot of people may consider, oh, it's just a headache. You know, you can push through it. You can deal with it. What they don't understand is all these complex symptoms that you can develop with migraines. It's not just the headache. It's, you know, you feel nauseous, you feel drained, you get the brain fog. And a lot of people, if they don't have migraines, think of just the pain. That think also that it could respond to Tylenol. You know, something simple you can take, but not everybody responds the same.
And so obviously the differences between a migraine and a headache is just that you're also dealing with all of these extra things that you're seeing here on the screen. You're dealing with that, with the fatigue and with the effect of light is having, things like that.
Exactly. And most headaches are not recurrent. Migraine is a chronic condition. We don't have a cure. So most patients will continue to have them.
And now when it comes to the factors that can increase migraine risk, let's go through some of them a little bit. So genetics play a big role. As you said, you had a family history and you now have migraines that you live with. So that family history, it's important to talk to your family members and have those conversations about anything that ails them, especially because it's so misunderstood.
Yes, exactly.
Now, sex also, so women significantly are more likely to experience migraines than men, as we talked about, and that's with the fluctuation of hormones. Hormonal changes in general, though, can also impact that. So women going through their menstrual cycle, pregnancy, and then menopause. So if you're in one of those stages, you may be at risk of experiencing one.
Or more frequent attacks.
And then stress and emotional stress. So we're talking about anxiety, depression. There is that connection there when it comes to the stress, the emotional stress of life.
Yes, so that's very important to address as well. We all get stressed. We all have work, we all have responsibilities, things like that. So learning to manage that as well as treat any underlying issues, it needs to be addressed.
When it comes to stress, we always talk about the importance of self-care and making sure that we're doing everything we can to minimize our stress levels. And so, especially knowing that a migraine is something that can happen if you aren't managing your stress. It's important to really learn all of those self-care strategies.
Yes, it is. It is.
And then another one is physical stress. So if you are somebody who does intense workouts, if you're doing strenuous activities, you're out gardening, you're out fixing the yard, especially after a storm, and you're taking down trees, things like that. That could be a major issue. And then fatigue, just being tired, can trigger an attack.
Yes, fatigue especially, and then poor sleep as well is a big trigger too.
And when it comes to poor sleep, it's not just not getting enough sleep that I understand. Like obviously not getting enough sleep totally impacts your entire health. You're supposed to get 7 to 9 hours
of sleep,
a day.
Yes, of restful sleep.
But excessive sleep, is that right?
Yes, excessive sleep can also trigger migraines. It can be too much sleep. Yes, as well, or poor sleep quality as well.
And then we're talking about environmental factors, which we talked about. So a change in the weather.
Yes, I have had patients who say a change in the weather, they can tell when that's going to trigger their migraines, whether it's a storm or what have you, they can tell.
And then strong smells. So obviously if you have perfumes, colognes, things like that. And was there a scent that you remember?
Not a specific perfume, but very strong ones would trigger my headaches. And one of the things I would always avoid, the dog and cat food aisle in the stores. I couldn't stand those smells.
Oh wow!
I couldn't stand those smells. So.
Yeah, and then as we talked about diet and food triggers. So those food triggers, it's really important to understand what sort of foods might impact you. So we're talking about additives.
Processed food, aged cheese has been known to trigger, excessive caffeine, alcohol has been known to trigger, particularly red wine. I mean, glass fine, but certain foods, chocolate, excessive chocolate can probably trigger some patients as well. But a lot of that processed food, aged food is.
Are there any medical conditions that can lead to potential migraines, like epilepsy or anything like that?
Not that they cause migraines, but they can be very related.
Okay.
They can be very related. A lot of patients with epilepsy will have severe headaches afterwards and can also have migraines as well. A lot of patients with multiple sclerosis, is very common for them to have migraines as well. Some Parkinson's patients too will also have migraines.
And one risk factor, as we're getting into the heat of summer, dehydration.
Yes, dehydration, adequate intake, adequate hydration is very important. It will definitely trigger migraines.
So making sure that you're drinking plenty of water. How much water should we be drinking a day?
I mean, it varies. Some people say 8 glasses a day, but I think everybody is a little bit different. But making sure that you're adequately hydrated.
And as long as you're drinking more than you're releasing through sweat.
Yes.
Because that's the other thing is you think that you're drinking your 8 glasses a day.
But maybe not.
And then it may not be sufficient because you haven't
especially right now with the
workout.
heat that we're having, the humidity, that's going to dehydrate us a lot more.
So making sure you're drinking plenty of water is always key. Again, and let's go back to some of those foods again when it comes to those foods that trigger migraines, because I think it's really important. And you talked about journaling it and writing it down, and that's really important. If you realize I've been eating this and I start experiencing migraines, let me write that down on my list to avoid them. So again, aged cheese, which I love cheese, so this kills me. Knock on wood, I don't suffer from migraines, but on that one, beverages containing alcohol, so watching your alcohol intake, and as you mentioned, red wine is particularly, people are sensitive to that one. Chocolate, and I know you said chocolate is supposed to be one of your triggers.
That's what I was told, but I haven't noticed that in a while. I haven't noticed that, but I was told to avoid chocolate.
But do you still eat chocolate from time to time? You tempt fate every now and then?
Yes.
All right. And then now food additives like nitrates and MSG. So I know you hear about MSG a lot in Chinese food, things like that. So just making sure that you're aware of those. Processed or cured foods. So hot dogs, pepperoni,
salami,
things like that. Like all those, you're getting ready for a barbecue, be really careful if you're having that hot dog. And then fermented or pickled food. So that's another trigger there. Now, when it comes to complications of migraines, if you aren't really treating them, handling them, are there any, do they increase your risk of any other disease or issue?
So we do know they're tied to isolation, social isolation, which can progress to anxiety, depression, depressed mood, because you're not able to do the things you're used to. You're limited in what you can do when you have a migraine attack. And if they're not treated and you continue to have more and more frequent episodes, you can start having things like anxiety, depression as well.
Is there any correlation between migraines and stroke that you've seen?
It's been theoretical that patients with migraine with aura, yes, we do think because of the vascular changes that we notice, that has been a thought that they are a higher risk for strokes. Patients with migraine with aura.
Now, when it comes to your mental health, and you talked about it, about that isolation that happens, and migraines and mental health. So about 20% of people with episodic migraines also have depression or anxiety. Between 30 and 50% of people with chronic migraine also have anxiety. People with migraine are about 5 times more likely to develop depression, and 87% of people with migraine think mental health would greatly improve from better migraine controls. This is all from the American Migraine Foundation. So there is that correlation, as you mentioned, with the mental health and making sure that you're taking all of the steps to the biggest and best thing that you can do is avoid your triggers.
Yes, exactly. And I've seen that a lot, all that tied together. And it's a group effort between your neurologist and your mental health expert to get that both of them under control, because they can both affect the other. Now,
when you talk about certain medications can impact your risk of a migraine, are there any that you know of that people should avoid if they get severe migraines?
So medication-wise, usually it's like the nitrates, statin has been associated, proton pump inhibitors, and those are usually prescribed for patients that need them. Okay. So usually you would try different variations of them, a different statin therapy, to try not to trigger your migraines.
Okay. And then let's talk about those symptoms again, because once again, it isn't just a headache, as people misunderstand. A migraine is serious, so you can get the nausea, the vomiting, you can get that increased sensitivity to light and sound. What was the thing that you would experience the most with your migraines? Was there any symptom that you recall?
Mainly the sensitivity to light and smell.
Okay, so those were the two there. You also obviously have sweating, poor concentration, feeling very hot or very cold, abdominal tummy pain, diarrhea, dizziness, lightheadedness. So those are all it just goes to show that there's a lot that really goes into play there.
Yes, exactly.
Now, when it comes to migraines, they are 4 stages, if I'm correct. Is that right? There are the 4 stages. So in the prodrome stage. That's the beginning stage, right?
Yes, and that's where some patients may start noticing that up to 48 hours before they even get the headache. The things like the sensitivity to light, they may feel the fatigue, the brain fog.
So before the actual pain
yes.
begins. And I was going to ask you that question. You answered it for me. Is it true that you can start experiencing some of those, like you're getting that warning sign that something's going to happen?
Exactly.
If you do experience that, is there anything that you can do to prevent the pain?
Yes, some of the medications now are being, and one of the newer CGRP ones is being used as a preventative in that way. Yes.
Okay. And then that stage 1, is there like a time, you said up to 48 hours before?
Before the headache onset.
All right. And then you get to the aura phase. Not everyone experiences that?
No, not everybody gets an aura. I never got an aura. Most of the auras that people will have are visual. They'll see sparkling lights, dark spots, visual, squiggly lines, different visual auras usually. But you can also have things like numbness and other symptoms. And those usually are before you get the pain, but you can also have them right when the headache starts, the aura.
All right, and then the headache phase obviously is the third stage, and it's the one most people imagine when they think about migraines.
Yes, the severe throbbing headache, you get nauseous, you're vomiting, you have the sensitivity to light and noise, the fatigue. That's the stage most patients don't want to move. They just want to be in a dark, quiet room, lights off, noise off, everything.
And then the final phase is the post-drome phase. And you can say that can just be as debilitating as the headache phase.
Yes, some people will feel generalized fatigue. They'll continue to have brain fog. They can still continue to have some of the nausea, some of those symptoms as well, and they can be just as debilitating.
Now, when it comes to migraines, you said they affect people differently, different symptoms. When it comes to those phases, can you go through all 4 phases or maybe just 1 or 2 of them and not necessarily like post-drome? You're not as fatigued coming out of it, let's
exactly. You can have, you may not have all of them. Some people may never have the pre-symptoms at all. They may not see them, or the aura especially is not in every patient.
And obviously, since they affect people differently, migraines can happen at various times. But is there like an average about how often for you to diagnose it as somebody having migraines, that they experience them like 3 times a month or something like that?
Not necessarily. It's more a clinical diagnosis, you know, examining the patient, listening to their history, because some patients may get to the point that they may not have a migraine for several months.
Okay.
So it's more of a clinical diagnosis. The throbbing headache, the sensitivity to light and noise, the nausea, that kind of picture.
Yeah, so how often do migraines tend to happen then in an individual?
It varies for person to person, and that's why we have so many different ways to treat it and address it. Some people may have multiple episodes a week, some may only have 1 episode a month, or every few months, depending how well controlled they are.
Okay, and then diagnosing the migraines, you said obviously there is no test that you can take that tells you.
MRI, no MRI is going to tell us. It's clinical history, talking to the patient, listening to their symptoms and what they have during that episode, and physical examination.
So if somebody suspects that they are living with migraines, and they're coming in to speak to their doctor for the first time, what are some of the questions that you ask them so that they can be thinking about as they're jotting down their notes? Because you should always come prepared to your doctor's appointments with all of your information. And so what would you want them to be telling you?
I typically ask them, what type of pain are you having? Where is the pain? Does it stay in that area? Does it move around? Do you have other symptoms associated with the pain? And I will typically list some of the symptoms as well. I ask, how long does this pain last? Did you notice anything before the headache started? Any, like the visual auras, anything like that? I ask, what did you try to take at home? If you tried to take anything, did it help? Overall, how long do your symptoms last if you take something or if you don't? And go from there. And especially if they have other symptoms like weakness or tingling, stuff like that as well, to rule out other stuff.
Okay. And would you refer someone to a specialist like a neurologist for further study?
Since I'm a neurologist, well,
you're seeing them all.
Yes, I see them all. A lot of primary doctors can handle migraines, but I think once it gets to the point where they're recurrent headaches and a lot of them are trying usually they try the first line medications if the patient is having multiple headache days a month. But I think after they've tried at least one medication, or if the migraines are not responding to your first line medications, you should refer them to a neurologist.
Okay. And now after a diagnosis, it's important to really educate yourself, right? About migraines, your triggers, all of the information that you need to avoid migraines.
Yes. And also, if you're started on medication, how these medications are helping you, whether they're helping you, how often they help you, if you have any side effects to these medications, so you can find the correct medications for you.
And how important is it to have a support system when you were dealing with your migraines? You're a mother of two, so making sure that your husband knows, I am going to be out of commission for a little bit, things like that. So a support system is really important.
Definitely, yes, because things like that, you may be debilitated to the point you don't want to come out of the room, you don't want to do anything, you don't want to cook, you don't want to clean, strenuous activity, right? So it's very important.
And you talked about medication when it comes to treating migraines, and you talked about the two types. So obviously there's the types to stop the migraine.
Yes.
So that's an instant sort of relief.
Effect. That's the goal. Yes, to stop the headache and treat symptoms like the nausea as well.
Okay, and then there's the preventative medicines.
Yes, those are usually, most of them used to be a daily medication that you would take to prevent and cut down on the number of migraine headaches you get a month and the severity of them as well.
Are there any other alternative therapies that are available?
Well, some people will also use like magnesium oxide. Riboflavin is one of them. Coenzyme Q10 is one of them that we use as well, that have been shown to help with migraine as well.
How does Botox help with migraines?
So we actually don't fully know how Botox helps with migraines. It's used mainly for chronic migraines, but you have to get it every 3 months.
And you can get it like in the target areas? No,
well, there's specific areas. It's not the same as regular.
It's not like, okay, take this wrinkle out and also help me with my migraines. Now, are there any over-the-counter medications that you recommend having in your medicine cabinet that might help with a migraine versus a headache?
So I usually recommend like naproxen, because it lasts longer than ibuprofen most of the time. The Excedrin migraines are also very good. The concern with these medications are to avoid taking them excessively, because then you can develop medication overuse headaches. But if you know you have less than 3 migraines a week, then you can keep those ready at hand if they work for you and take them most of the time I tell my patients, as soon as you notice the aura, to take the medication. The earlier you treat a migraine, the more effective your medication will be.
And then when it comes to that migraine diary that you talked about, some of that important information that you should have is obviously detailing the times that you have a migraine. So obviously the date, the time, what you were doing when the migraine attack began. It's really important to know, were you doing strenuous activity outside? Were you just watching some television? It could be you're watching a movie and they warn you ahead of time there's a lot of light and sound. And how long the attack lasted. So that's also really important. What are the symptoms that you experienced? So obviously detailing that, and then what medication you took, if any. Is there anything else that you recommend that they be writing down?
No, I think that about covers it, especially time as well. One of the things that has been related to migraines is obstructive sleep apnea too. So typically those patients will also can have migraines, and knowing if these headaches started in the early morning versus later in the day will be helpful as well.
Now, when it comes to obviously medication and painkillers or anything that you may take, it's important to talk to your doctor about anything that you took for the migraine, right?
Yes, it is.
What is the danger of taking painkillers for too long?
So, of course, with the NSAIDs, the concern are for patients who are at risk for things like gastric ulcers, kidney disease. That's important in that regards. Excessive Tylenol, as we know, the liver, right? But also in migraines, the concern is if you start taking them daily for something other than a migraine, as well, you can develop medication overuse headaches. And once that starts happening, these medication overuse headaches are typically kind of dull, achy, daily headaches that you can, you take something, it kind of calms down, but it'll eventually come back and never really goes away. And when patients have these type of headaches superimposed on migraines, it makes it difficult to figure out a better treatment and whether their headaches are just migraines or something else.
So what advice, especially as a migraine sufferer, do you have how do you deal with a migraine as it happens? What is your advice for that?
So if I start feeling like I'm going to have a migraine, I will usually, for me, naproxen works. I will usually take the medication I know works for me, and I try to avoid more of the triggers. So say if I'm outside in the heat, try to come inside in a cool place, a quiet area, lower the noise levels and things like that.
So resting in a dark, quiet, cool room, applying a cold or warm compress or washcloth to your forehead or behind the neck can also be beneficial. Massaging your scalp.
Yes.
And I've seen those the scalp massagers that are amazing, by the way. You should always you should have one. They're very handy. Applying pressure to your temples in a circular motion and keeping yourself in a calm state. So try meditating, calm state, trying to remain calm. And again, avoiding the triggers. Moving out of the situation and getting yourself into a dark room.
And quiet area.
Quiet, calm, not a lot of light, and do that. Now, can a migraine be prevented?
So the goal with that would be the preventative medications to cut down on the number you're having in a month. That's the main way we try to prevent a migraine.
Okay, so some of the keys when it comes to preventing migraines or lessening their impact is obviously identifying and avoiding triggers.
Yes.
Number one, staying hydrated. We talked about being dehydrated, so drinking plenty of water. A regular sleep schedule. Doctor, how many hours are we supposed to sleep a week?
About
a day?
7 to 9.
Not a week, a day. 7 to 9 a day. And then a balanced diet. And we always talk about the importance of healthy eating for your maintaining a healthy weight, things like that. But it can also impact what you eat. Can impact your migraines. Managing stress, so finding out ways to reduce stress in your life. Meditation, deep breathing, take a yoga class, do some Pilates, whatever it can to help. Regular exercise, so moderate exercise can reduce stress and improve your overall well-being, but avoid overexertion. So making sure that you're not overdoing it.
Overdoing it too.
You're not a weightlifter, right? Magnesium supplementation. So do magnesium supplements help? Yes,
we do use that. A lot of physicians will also use magnesium oxide typically, 400 milligrams a day, and for migraine prevention.
Okay, 400 milligrams a day of magnesium. Consider riboflavin, vitamin B2. So that can also help?
Yes, it has been shown to help as well in migraine prevention.
Okay, and then when you're managing, once again, that attack, rest in a dark, quiet space. So that's one of the key things that you can do. All right, now, so when should you see your doctor when it comes to migraines and if you suspect that you're having them?
I would definitely see a doctor if you have more than one episode, especially close together, because even if you don't need a preventative medication, if you don't need to take something daily, there's always acute medications that can help. If you're okay with, over-the-counter medications, that's okay, but getting the diagnosis is also very helpful, just so you know as well what's going on with you.
And then you can be really building that relationship with your doctor and checking, and again, because not all medications when you're are going to work the same way, the same dosages, so you might have to really adjust what your treatment plan is, but it's working with your doctor to get to that point.
Yes, and if you're already seeing someone but the medications you're on are causing too many side effects or are not effective, then you need to keep seeing your physician regularly.
So when should you see when a healthcare provider immediately, or go to an ER then if you're dealing with something and it's a really severe attack?
If it's a new onset migraine or a new onset headache in general, most people should be seen by a physician. If it's you've never had a headache, severe pain, I would recommend seeing a physician. If you have symptoms such as, because again, some patients with migraines may have symptoms of stroke-like symptoms. I would definitely get seen.
And even heart attack symptoms, because I know you get like the stiffness in the neck, the jaw, things like that. So there could be some confusion. So if
some
there's
mixed
anything
symptoms that's not your normal, you need to get seen.
All righty. Well, we appreciate all of your time. Thank you so much for joining us.
Thank you.
This has all been very, very informational and beneficial to us. So thank you.
Thank you.
And that officially concludes our webinar. Thank you for joining us. We hope you will continue to prioritize your health and the health of your loved ones. We hope to see you for our next installment of this Let's Talk Your Health series on Tuesday, July 15th from 5:30 to 6:30 p.m. when we discuss UV safety. Like and follow the South Texas Health System Facebook page for more details on our future Let's Talk webinars. And if you'd like to see our previous Let's Talk seminars, all you have to do is visit sthsletstalk.com. Until our next seminar, stay healthy, stay safe, and please continue to prioritize your health. At South Texas Health System, the health of you and your family has always been our top priority. It inspires us to be among the nation's healthcare leaders. We're proud to be home to the Valley's first and only freestanding children's hospital, the state's first dedicated heart hospital, the first behavioral health facility with private inpatient treatment, and Hidalgo County's first level 2 trauma center. And we continue to transform healthcare, investing in advanced technologies and innovations to help you heal faster. It's that commitment to your health that has allowed South Texas Health System to build a reputation for excellence across 11 facilities, earning recognition for patient safety, cardiac care, robotic surgery, women's health, stroke care, and more. With our integrated network of nationally recognized facilities, freestanding emergency departments, physician practices, and outpatient centers, we are where you are, providing compassionate care and comprehensive services for you and your family.